Reactive mucosal lesion. Reactive lesions are hyperplastic tissue that form as a result of the repair response. Let's learn some high-yield information about assorted reactive mucosal lesions. Amalgam tattoo, gray, blue, black discoloration on the oral mucosal membranes must know this common and benign lesion is often mistaken for melanoma, and the radiopaque particles can be viewed on the radiographs. Amalgam tattoo. Chemical burn, a whitish sloughing appearance on the mucosal membranes as a result of chemical reactivity. Must know common compounds that cause chemical burns include hydrogen peroxide, aspirin, sulfur nitrate, and phenol. Chemical burn. Dentifrice associated sloughing of the mucosal membranes due to sodium lauryl sulfate, a common surfactant in toothpaste and mouthwashes. Must know to treat success non-SLS brands such as Sensodyne, Tom's of Maine H. Dentifrice associated sloughing. Hairy tongue. Tongue appear dark and furry due to build up of dead skin cells on fully formed papillae. Must know poor oral hygiene, certain medication or antibiotics, tobacco use or radiation treatment of head, neck, or potential causes of this condition. Hairy tongue. Linear amber, a fibrous white line in the buccal mucosa. Must know linear amber is type of focal hyperkeratosis that forms as a result of chronic friction of mucosa. Linear amber. Melanotic macule, benign hyperpigmentation in the mucosal membrane. Must know this is essentially that the freckle of the mucosa. Post-Janker syndrome, PGS, is a condition that puts patients at an increased risk of developing certain cancers, with colorectal cancers being the most common. A feature of PGS is freckling, often around the lips and mouth, thin pigmented lips, mouth, and genuine polyps. Inflamed salivary duct openings. Nicotine stomatitis will be malignant if associated with severe smoking. The lead end of the cigarette is in the mouth. Nicotine stomatitis. Smoking associated melanosis. Increased tissue pigmentation due to irritation from tobacco smoke. Must know tobacco chemicals can stimulate melanocytes, which result in the diffuse brown macules that are typically seen in the anterior gingiva. This condition is reversible if tobacco smoking is ceased. Smoking associated melanosis. Submucosal hemorrhage, extravascular lesion that do not blanch, or blood that has escaped the vessels into tissues, and thus blood pressure cannot be entered. Must know these hemorrhages are characterized based on size. Petechia 1 mm, purpura slightly larger than petechia, ecchymosis 1+ cm. Hematoma, mass of blood within tissue, often caused by trauma to oral mucosa. Submucosal hemorrhage, traumatic ulcer, a complete break through the epithelium. Must know this common condition differs from erosion, which is an incomplete break of the epithelium. Traumatic ulcer, the grafts of reactive mucosal lesions. Let's move on to learning about high-yield infectious lesions. infectious mucosal lesions. This section will highlight various viral, bacterial, and fungal infections you need to know. For IMBD, viral infections